Welcome to our lecture for today, all about the blood supply of the brain and spinal cord. I'm Dr. Mechanism Bufay. We'll identify the arterial supply of the brain, the venous system, and sinuses of the central nervous system. Be acquainted with how the vasculature span the central nervous system and to correlate the learned knowledge of a given case, especially in your laboratory, and to appreciate the structures that make up the blood supply of the brain and the spinal cord. The brain and spinal cord develop from the ectodermal neural tube. The anterior part of the neural tube expands along with the associated neural crest tissue, and there would be constrictions in this expanded tube soon appear, creating three regions called primary brain vesicles. These are your three primary brain vesicles: prosencephalon, mesencephalon, robencephalon. Prosencephalon will make up the different structures of the forebrain, mesencephalon, midbrain, and robencephalon, hindbrain. At a 3 to 4 week embryo, there would be three primary brain vesicles. At a 5-week embryo, there would be five secondary brain vesicles. Secondary, primary. 3 weeks, three primary brain vesicles. 5-week embryo, five secondary brain vesicles. Your prosencephalon will make up your telencephalon, diencephalon. Then mesencephalon, still mesencephalon. Your rhombencephalon would be make up your metencephalon and myelencephalon. Your telencephalon will later become your cerebrum. Diencephalon, including your thalamus, hypothalamus, and epithalamus. Mesencephalon will develop into your midbrain, metencephalon to your pons and cerebellum, and myelencephalon would be your medulla oblongata. And it's important to note also with the different cavities of the brain, okay, with the adult structures derived from in the different secondary brain vesicles here. The major divisions of the brain include the forebrain, midbrain, and hindbrain. Your forebrain is composed of your cerebrum and the encephalon, your midbrain and your hindbrain composed of your pons, medulla oblongata, and your cerebellum. Forebrain makes up your cerebrum and your diencephalon, including your thalamus, hypothalamus, and pineal gland or epithalamus. And then your midbrain, pons, and medulla referred to as your brainstem. And then you have your cerebellum. We'll discuss about the different branches of the aorta, okay, supplying the brain and the spinal cord. Okay, you will know later on that there are different branches of the aorta that would supply the spinal cord. Remember that your arch of the aorta and its main branches has a mnemonic ABCS or ABCs. A stands for arch of the aorta, B, brachiocephalic artery, C, left common carotid artery, and S, left subclavian artery. Because your right subclavian and your right common carotid artery will arise from the brachiocephalic artery. Here are the different branches of the aorta. You have the ascending aorta, arch of the aorta, thoracic and abdominal aorta, and its different branches. Arch of the aorta ABCs, arch of the aorta, brachiocephalic artery, left common carotid artery, and left subclavian artery. Your right common carotid and right subclavian will branch from the brachiocephalic artery. We will discuss about the circle of Willis. And here you could see the different structures of the circle of Willis and together with the brain and their anatomical positions. The blood supply of the brain, the two pairs of arteries, the carotid and vertebral arteries. The internal carotid artery system comprise 80% of the brain's blood supply, which is the anterior circulation. The vertebral basilar system from the subclavian artery comprise 20% of the posterior circulation. The different branches anastomose in the arterial circle of Willis. So this is the circle of Willis. We'll discuss about the different structures of the circle of Willis one by one. Okay, internal carotid artery is this one. The internal carotid artery is a branch coming from the common carotid artery. Okay. And then your vertebral artery, this one, okay, vertebral basilar, because when the two vertebral arteries, the right and the left vertebral arteries meet, they form your basilar artery. Here you could see the common carotid artery having branches of the external and internal carotid artery. Internal is part of your circle of Willis, and your subclavian artery will give off your vertebral artery. Again, vertebral artery, when they meet, they form your basilar at the pons of the brainstem. And you also have the internal carotid artery, which will have different branches that make up part of the circle of Willis, or your cerebral arterial circle. Here you could see that the subclavian artery will pass through the different foramina of the transverse processes of your cervical segment of your vertebrae, and it has different parts. Different segments. Preforaminal includes the vertebral artery from the subclavian artery to the transverse foramen of C6. Foraminal, foramen, through the transverse foramina of C6 to C2. Extradural from the transverse foramen of the axis or C2. C1 is your atlas, to the vertebral canal, and intradural from the vertebral canal to the inferior border of the pons. So we know that the vertebral artery from the subclavian artery reaches the part of the brainstem at the pons area. The vertebral artery has the different branches: anterior spinal, posterior spinal arteries, the posterior inferior cerebellar artery or your PICA, then meningeal, medullary, and basilar arteries. Again, from the subclavian, you will see the vertebral artery passing through the foramina of the transverse process, the transverse foramina of the cervical vertebrae. When the two vertebral arteries meet, they form your basilar artery at the pons area. The arterial supply of the forebrain. Remember, the forebrain is the cerebrum and your diencephalon. Arterial supply is derived from two internal carotid artery, internal and internal carotid artery, and your basilar artery, or basilar artery made by the union of your two vertebral arteries. Again, circle of Willis, vertebral, basilar, internal carotid artery coming from the common carotid artery. And here you can see the vertebral arteries going up to the pons area, okay, to make up your basilar artery. Vertebral plus vertebral at the pons area, it forms your basilar artery. Okay, again, anterior, posterior brachiocephalic trunk at the right side gives off your subclavian artery and your right common carotid artery. The vertebral artery comes from the subclavian artery. The internal carotid artery comes from the common carotid artery. Your internal carotid arteries enters the subarachnoid space by piercing the roof of the cavernous sinus. Here you have your common carotid artery, external carotid artery, internal carotid artery, piercing the cavernous sinus to reach the roof of the piercing the cavernous sinus to enter the subarachnoid space. And it has the different branches. It has an ophthalmic branch, posterior communicating artery, which is part of your circle of Willis. You have an anterior choroidal artery, and then it has different branches of your, including your middle cerebral artery and your anterior cerebral artery. Here you could see that the internal carotid arteries having the different branches: ophthalmic, posterior communicating artery, anterior choroidal artery, and the anterior cerebral and the middle cerebral artery. Your ophthalmic artery, which is a branch of your internal carotid artery, is this one. It enters the orbit When you say orbit, it's the space where your eyeballs are located. Okay? So enters the orbit with the optic nerve, cranial nerve number 2. This is your optic nerve or cranial nerve number 2, ophthalmic artery, enters the orbit. The central artery of the retina, which is a branch of your ophthalmic artery, this one, ophthalmic artery, there's a branch, central retinal artery. Okay? And then when there is occlusion, it results to blindness. Your basilar artery, this one or this one, divides at the upper border of the pons, into two posterior cerebral arteries. Okay? Cerebral from cerebellar is different. Cerebral, it's refers to the cerebrum. Cerebellar, cerebellum. Okay? Basilar divides into two posterior cerebral arteries. Cerebral artery, posterior cerebral artery. Okay? Posterior cerebral artery. Together with the posterior communicating artery, and links with the two anterior cerebral arteries, anterior cerebral artery, with the anterior communicating artery, which is this one, will form your cerebral arterial circle or your circle of Willis. So this is the circle of Willis. Okay? You have your posterior cerebral, anterior cerebral, posterior communicating artery, anterior communicating artery with your internal carotid artery, no, make up your circle of Willis. Again, let's trace vertebral plus vertebral basilar at the pons area. You have your posterior cerebral arteries, posterior internal carotid artery. You have your anterior cerebral artery, and then your posterior communicating artery, and your anterior communicating artery. Your posterior communicating artery, this one, irrigates the hypothalamus and ventrithalamus. The second most common aneurysm of the circle of Willis leads to a third nerve palsy. Okay, so this is your basilar, posterior cerebral, connecting it to the internal carotid artery would be your posterior communicating artery. Choroid plexus of the lateral ventricle. The choroid plexus is a secretory tissue found in each of the brain ventricles, the main function of which is to produce cerebrospinal fluid. Okay, your CSF is found in your ventricles. So you have your anterior choroidal branch coming from the internal carotid artery and the posterior choroidal branch of the posterior cerebral artery. Here you could see the anterior choroidal artery, and you have your lateral and medial posterior choroidal arteries. Okay, lateral and your medial posterior choroidal arteries, anterior to posterior. Your anterior cerebral artery passes above the optic chiasm, which is this one, to gain the medial surface of the cerebral hemisphere through the longitudinal fissure. Your anterior cerebral artery, this one, supplies the medial surface of the cerebral hemisphere from the frontal pole to the parietal occipital sulcus. Okay, so you have here your anterior cerebral artery. Medial surface of the brain, cerebrum. Okay, medial surface, not lateral, medial. The medial cerebral arteries, okay, supplies the lateral convexity of the hemispheres. Medial, anterior cerebral. Lateral convexity, medial cerebral artery. Here you could see the inferior division and the superior division of your medial cerebral artery. Okay, supplies the Broca's and Wernicke's speech areas, the face and arm areas of the motor sensory cortices, and the frontal eye field. So if there is a problem with your medial cerebral arteries, these different areas would have a problem. Lateral straight arteries are penetrating branches of your medial cerebral arteries. These are the arteries of stroke because they supply the internal capsule, caudate nucleus, putamen, and globus pallidus. So when you have a stroke syndrome, it refers to a pure motor hemiplegia, meaning there is paralysis of one side of the body. If there is a problem, then there would be lacunar stroke coming from the lateral striate arteries. Let's proceed to the arterial supply of the hindbrain, including, when you say hindbrain, it includes your pons, medulla oblongata, and your cerebellum. Your hindbrain is supplied by the vertebral and basilar arteries and their branches because they are located posteriorly. We have been talking about the vertebral artery, which is a branch of the subclavian artery, and it ascends to the neck in the transverse foramina, the holes or the openings at the transverse processes of your upper six cervical vertebrae. Your vertebral artery gives rise to the anterior spinal artery. This is your anterior spinal artery. And the pica or your posterior inferior cerebellar artery. This is your posterior inferior cerebellar artery. Okay? It supplies your dorsolateral quadrant of the medulla and the inferior surface of your cerebellum. Other branches includes your meningeal branch, posterior spinal artery, and your medullary arteries. Your vertebral artery enters the skull through the foramen magnum and unite at the lower border of the pons to form the basilar artery. Okay, this is your pons. At the lower border of your pons, the vertebral arteries meet to form your basilar artery. Here you could see, this is anterior, this is posterior. You could see that vertebral arteries joining at the lower border of your pons to form your basilar artery. And your vertebral artery has an anterior spinal artery branch and a posterior inferior communicating artery, which is your pica. Let's talk about your basilar artery. So this is your basilar artery. Has the different branches. Pontine arteries are this one. They supply the base of the pons, which includes the corticospinal fibers and the exiting root fibers of your abducent nerve or your cranial nerve number 6. Your cranial nerve number 6 is responsible for the lateral gaze or supplying or innervating your lateral rectus of the extraocular muscles. Movement of the eye laterally. You have also your labyrinthine artery that supplies the structures of the inner ear. This is your labyrinthine artery. If you have a pica, that is a branch of your vertebral artery, you have also an ICA, anterior inferior cerebellar artery, supplying the anterior and inferior parts of your cerebellum. Okay, so this is your ICA. Pica is a branch of your vertebral artery. Your ICA is a branch of your basilar artery. You also have a superior cerebellar artery or your SCA. Arises close to the termination of the basilar artery. Close to the termination of the basilar artery, you have your SCA, superior cerebellar artery, because it's superior because it's located at the superior portion of the cerebellum. At the superior portion of your cerebellum. Your cerebellum would be here behind your pons. Okay, so you have an ICA coming from the branch of your basilar. Your pica is a branch coming from your vertebral artery. Then you have your posterior cerebral arteries connected to the internal carotid artery through the posterior communicating artery. This is a major supply of the midbrain and supplies the thalamus and occipital lobe. Posterior cerebral posterior cerebral arteries. Okay? Occlusion of this artery results in a contralateral hemianopia with macular sparing. Posterior cerebral artery. So you have here, so you see here the cerebellum. At the posterior inferior portion, you have your pica. From your vertebral artery, you have your anterior spinal artery. It's located anterior to your spinal cord. You have here an anterior inferior, your ICA, which is a branch of your basilar. Pontine arteries, because they supply the base of the pons. And you have here the superior cerebellar artery supplying the superior portion of your cerebellum, your posterior cerebral artery, no, supplying the midbrain and thalamus. Okay, it's connected to the internal carotid artery through the posterior communicating artery. Let's go to the nerve supply of the cerebral arteries. This one. Sympathetic postganglionic nerve fibers of superior cervical sympathetic ganglion. So you have different ganglia near and associated to your vertebral artery or the cerebral arteries. Let's talk about the venous drainage of the brain. You have a superficial and deep parts of the veins. Your superficial veins, so when you say superficial, it's superficially located. The veins lie in the subarachnoid space overlying the hemispheres. You have right and left hemispheres of the cerebrum. Drains the cerebral cortex and underlying white matter and empty into the intracranial venous sinuses. Okay, so you have here superficial cerebral veins. Okay, and you have different parts of the superficial veins. The upper part of each hemisphere drains into the superior sagittal sinus. Superior part drained by the superior sagittal sinus. The middle part drains into the cavernous sinus by way of the superficial middle cerebral vein. Middle by the superficial middle cerebral vein. And the lower part is drained into the transverse sinus. Lower part. Superior part drained by the superior sagittal sinus. Middle part by the superficial middle cerebral vein. And the lower part drained by your transverse sinus. Those were your superficial veins. Let's talk about your deep veins. The deep cerebral veins drain into the corpus striatum, thalamus, and cord plexuses. Thalamus striate veins drains the thalamus and caudate nucleus, form the internal cerebral vein together with the choroidal vein. Okay, formed by, so this is your thalamus striate thalamus striate veins rather. Okay, formed by the internal cerebral vein, and the choroidal vein. Choroidal vein, internal cerebral vein, thalamus striate vein. Okay? Your great cerebral vein of Galen are two internal cerebral veins unite beneath the corpus callosum. Drains the deep cerebral veins into the straight sinus. Okay? Internal cerebral vein, they drain into your great cerebral vein of Galen and then eventually drains to your great straight sinus. Then you have your basal vein, which is this one. Union of the anterior and deep middle cerebral veins drains and empties into the great cerebral vein. So they drain and empty into the great cerebral vein of Galen also. The deep veins drain into the transverse, straight, and sigmoid sinuses. So these are the different veins that drain the deep part of the brain. Okay, so let's talk about the blood supply of the spinal cord. You have an anterior, posterior, and segmental spinal arteries. Okay. The posterior spinal arteries, which are this one, arises directly from the vertebral arteries. Remember your vertebral arteries arising from your subclavian artery. They arise directly, the posterior spinal arteries, inside the skull or indirectly from the posterior inferior cerebellar arteries. Okay. Posterior spinal arteries may arise coming directly from the vertebral arteries or from its branch, the posterior inferior cerebellar arteries or your pica, into your posterior spinal arteries. And we all know that anterior spinal arteries are formed by the union of two arteries of which arises from the vertebral artery inside the skull. Okay, so this is your anterior spinal artery, posterior spinal artery. So anterior spinal artery. Okay, so your posterior spinal artery may arise directly from the vertebral, from the vertebral arteries or from the pica or your posterior inferior cerebellar arteries. They have branches that are your posterior spinal arteries. And you have your segmental spinal arteries gives rise to anterior and posterior radicular arteries. Okay, you have your posterior spinal artery, anterior spinal artery. You have your segmental arteries at the sides, giving off your posterior radicular artery and anterior radicular artery. Okay? Posterior spinal, anterior spinal, segmental artery, posterior radicular artery, anterior radicular artery. You have the great anterior medullary artery of your Adamkiewicz, arises from the aorta. In the lower thoracic or upper lumbar vertebral levels, it's unilateral, one side. In majority of the humans, it enters the spinal cord from the left side, usually at the left side because your aorta, although it's at the midline, it's more located at the left side. So this is your artery of Adamkiewicz, more at the left side, entering the spinal cord. And then lastly, the veins of the spinal cord, they drain mainly into the internal vertebral venous plexus. Okay? Internal vertebral venous plexus. So you see here the different veins that interact to drain your spinal cord. Spinal cord, vertebral body, spinous process, the different internal vertebral venous plexuses. Okay, internal vertebral venous plexus or Batson's veins here. So they drain eventually here at the different internal vertebral venous plexus. Okay, so we have discussed the different arteries and veins that supply your or play a part in your brain and spinal cord. Okay, thank you.